And I'm hopeful that within a few weeks' time, there will be the beginnings of some signals about how our vaccine programme is being effective. That signal will begin with infections, but over time we will get more data on hospitalisations and on deaths. And I want to make a really important point here, that although the clinical trials data report headline results in terms of the prevention of infections with symptoms, in public health terms, what is going to change this for us is reductions in hospitalisations, in severe disease, in other words. And we have very real hope that the vaccines in time are going to lead the way on this.
It is important that it's not the vaccines, it's the vaccinations that need to happen, and that needs to happen right the way across the world. This is a global pandemic, and it is important that we see vaccination across the world, especially in countries that perhaps aren't as well prepared in terms of their vaccine supply, low and middle income countries that do need the support to do this. This has to be a global effort to try and get this disease under control.
We will be setting out, I will be setting out by February the 22nd, more of a route map. If you remember what we did last year, we were able, after the first phase, to set out some tentative dates by which we hoped to do certain things, and actually we were pretty much able to keep to those dates. I'm not saying that we'll be able to keep to all of them. There may be an adjustable element to this timetable, but that's obviously what we'll be hoping to set out on February the 22nd. More of a roadmap for everybody to think about.
Do children get COVID-19? Yes. Do children get ill with COVID-19? Very rarely indeed. Do children transmit COVID-19? Yes, but it is predominantly a signal towards the upper teenage years. In other words, the more adult-like they become, the greater propensity for them to transmit to others. Do teachers get COVID-19? Yes. Is it clear that teachers get COVID-19 from children or from each other? No, it is not clear. They could also pick it up in their own lives outside of school. Is there a clear signal in the data of a markedly increased rate of infection or mortality in teachers? No. But could infected children introduce the infection back in their own households and therefore contribute to R? Absolutely yes.
Of course, I take full responsibility for everything. All I would say, humbly and respectfully, to those who make criticisms of what the government has and all our colleagues have been trying to do, is that in situations like this, where you have such very, very brutal and difficult dilemmas, there are no easy answers, and there are very often there are no good answers at all. The government has done its best, as I say, to protect life and to minimise suffering, and we're going to continue to do that. There will come a time, obviously, for the learning of lessons, and there will be a full inquiry into everything, a moment to reflect and to understand and to prepare. But as I said earlier on in the House, and I think yesterday as well, I don't believe that time is right now, when we have infection very high, the NHS battling heroically against this disease, and the whole of British officialdom really fighting to control and defeat coronavirus. I don't think it's the right use of official time at the moment, but that moment surely will come. We in the UK firmly believe that the creation of vaccines is as a result of international exchange, international partnerships, and the distribution of vaccines around the world is also going to be a great multinational, international effort. The UK leads, as you know, Jim, in supporting COVAX, the great global initiative to help ensure that people across the planet, in the poorest countries in the world, get the vaccines that we need. And I think we're the second biggest funder in the world of that initiative.
How do you feel about the pressure being placed on AstraZeneca? Are you angry about it?
I admire the way you got in the supplementary there, Jim. But I will stick firmly to my lines, which is that I think that we're confident in our supply, confident in the contracts that we have. I think that the Oxford AstraZeneca vaccine is obviously very important for our country and for the world. And the matter in question is for the EU, our friends in the EU, and